It's time for a 2026 Medicare update. Let me show you what's happening for next year. And the news is big, and you want to make sure you understand everything. I'm Erin Ackenheil. I own Black Point Insurance, and let's get this thing started. The first thing to know is a little bit about me and my company. We're all about helping people stay educated on the A, B, C's, and D's of Medicare. And our whole background is education, making sure you have what you need to make a great decision. One of the biggest things you can do to help me grow or to learn more is to follow us on YouTube, where we produce several different videos on every topic, from updates for 2026 to what to do when you travel or how to get a prescription authorized. What you can do is take out your iPhone, open your camera, and scan this QR code right here, and you can like and subscribe videos right there on your phone. So please do that and help support us. Me and my team and any broker in general, we're going to be here to help support you with plan review support, helping you with various different plans so you don't have to do all that shopping yourself, and you have the opportunity to get the support you need to make good decisions about your health care. The agenda for today is talking over the A, B, C's, and D's of Medicare for 2026. What's changed? What's the same? What is the impact to you? A lot of people wonder, how do I cover the gaps in my Medicare? And we're going to describe in some detail the difference between ABC Medicare Advantage and AB Medigap and D. And what are the differences? What are the benefits and advantages of each type of plan? Then we're going to speak about 2026 standard design to drug coverage for next year and the impacts to your Part C Medicare Advantage and your Part D drug plans, and then the specific changes to those plans and any next steps for you. So first off, let's talk about Medicare Part A. Part A of Medicare is considered the hospital portion of Medicare. When you have A, you have a red, white, and blue Medicare card that says Part A Hospital and an effective date. For most people, this doesn't cost anything. So you're entitled to premium-free Medicare Part A if you or a spouse you were married to worked for 10 years or more, paying into the Medicare line item. So most people, fortunately, don't have to pay again for Medicare A. But when you use the benefits and services of Part A, you share in some of the costs. The main benefit covered under the Part A program is room and board in the hospital. Physician charges can be separate on Medicare Part A. So when you think about room and board in the hospital, you get admitted. Those are things like your fancy room, the TV, the meals you receive. That's all going to be part of the room and board under Medicare Part A. And if you're admitted to the hospital, Part A has a first minute deductible of $1,736 for 2026. So this is a change. The costs are going up, and the new figure is $1,736. If you're admitted to the hospital, released, and readmitted within 60 days, you don't pay again. But anytime your exit from the hospital has been 60 days or more, you do need to pay the Part A deductible once again. After you're admitted to the hospital for your room and board charges, days 0 through 60 are covered for that one-time deductible of $1,736. But keep in mind, if you see someone with the name doctor while you're there, a surgeon, an anesthesiologist, those charges can be separate and carry additional costs for you. Your room and board in the hospital, most of you fortunately won't stay there more than 60 days in a row. But if you do, you have to pay more in terms of copays with Medicare Part A. This is, of course, keep in mind if you don't already have a Medicare Advantage or a supplemental plan, if you're just paying on your own with original Medicare. God forbid you're in the hospital more than 60 days in a row. In 2026, days 61 through 90 is going to be $434 per day. If you go over 90 days in the hospital, you're tapping into your lifetime reserve days with original Medicare, and days 90 through 150 would be $868 per day in 2026. If you needed to be in the hospital more than 150 days in a row, and your only coverage was Medicare Part A for your hospitalization, you would be out of room and board hospital under the Part A program. Skilled nursing facility care, or SNF care, usually transitional between hospital and home. Maybe someone had a stroke or a hip replacement. The first 20 days under Medicare are covered 100%, but should you need to stay longer, day 21 through 100 is $217 per day in 2026. Medicare continues to cover the hospice program, the comfort care under Part A, very well, going into 2026 with 100% coverage for comfort care. Medicare Part B is the part that most of us pay for under the Medicare program. When you have Medicare Part B, you have that original Medicare card and it says Part B Medical, which stands for the doctor's visits under the Medicare program, and there's an effective date on your red, white, and blue Medicare card. For most people, they are paying a monthly premium for Medicare Part B. If you're drawing Social Security, they're going to automatically deduct that premium right out of your Social Security check before you even see it. If you're not drawing Social Security, it's typically billed quarterly. You can create an online account on Medicare.gov to make that premium payment. 202.90 is considered standard for next year. That's up from 185 in 2025. Some people pay more or less for Medicare based on their income. You can watch the next video, which is all about the high IRMA charges for 2026, income-related monthly adjustment amounts. This is what happens when your income in 2024 was higher than a standard threshold. Medicare can be substantially more expensive in that situation. If you've had a life change, you might be able to get that premium reconsidered, and you can read all about that or hear all about that in the complimentary video. It is part of original Medicare. Sometimes people can get their Part B cost reduced or waived if they're low income. There are some state programs that can help to cover those costs. Again, we'll have a complimentary video on that as well if you think that's applicable to you. Now, Medicare Part B is really important. I always say A and B, original Medicare, are the price of admission to get additional coverage, whether that additional coverage is a Part C Medicare Advantage or it's original Medicare with a Medigap like a G plan paired with standalone drug coverage. Part B is important. You must have it to get that additional coverage. And unfortunately, even though Part B covers many, many services, it doesn't cover it 100%. Any kind of preventive care is Medicare Part B, any visits with your doctor or specialist, emergency room, ambulance, expensive treatment like chemotherapy, radiation treatment, renal dialysis, it's all going to fall under this Part B umbrella. And this is why the insurance companies make sure that you pay for your Part B in order to get additional coverage, because so many important things are going to be included here. However, if you don't have additional coverage, your out-of-pocket costs could be substantial under Medicare Part B with no max out-of-pocket ceiling. A couple things to keep in mind. Under Medicare Part B, Medicare typically pays 80% of a given service and you pay 20%. So if that ambulance ride is $3,000, Medicare is paying 80% and you're paying 20% of that bill. In addition, if you have outpatient surgery and that bill's $30,000, Medicare is paying 80% of that, you're paying 20%, and there's no max out-of-pocket ceiling for what you will pay under the original Medicare program. In addition, if you see providers that accept Medicare but don't take Medicare assignment or Medicare's reduced rates, you can be balance billed for the difference, up to 115% of Medicare's allowable charges based on how that provider has designated themselves with Medicare. So this is a watch out under the original Medicare program, and just another reason while having a supplemental or an advantage plan makes sense to cover those gaps under original Medicare. Medicare Part B as in boy does have a deductible each calendar year. This year in 2025, it's been $257. Next year, 2026, it's $283. A deductible means you have to pay that amount before additional coverage will kick in. So if you're going with original Medicare and a supplement, for instance, you're usually going to have to meet that $283 deductible before the 20% and any excess charges are paid. If you choose an advantage plan, you may get that deductible waived, but you could have to pay applicable copays. The other thing to note under Medicare Part B is not everything out there that you may think you need is going to be covered under the Part B program. For instance, prescriptions on an outpatient basis are not covered under Medicare B. You need a standalone drug plan to cover your drug coverage, or you need the prescription drug coverage embedded in a Medicare Advantage plan. You can't get drug coverage directly from Medicare or as part of the Part B program. Dental, whether that's for cleanings or major dental or dentures or what have you, Medicare does not pay for that. Routine eye exams and glasses, not part of the original Medicare program. Routine hearing exams and hearing aids, they're not included. Another important thing to note is original Medicare does not cover routine physicals. So you may be used to getting a head-to-toe physical. Medicare doesn't pay for that. They do pay for a new to Medicare wellness exam and an annual Medicare wellness check. So if you're on Medicare and a supplement like a Plan G, you have to be mindful of the fact that you want to have your wellness exams versus physicals if you want to ensure coverage. The other thing under original Medicare Part B is foreign travel is not covered. So in the United States, sure, you're covered, but if you leave the country, you don't have any additional coverage once you leave. And so that's something you can take advantage of either through a Part C Advantage plan or through a Medigap plus a drug plan. So something to keep in mind. So Part C. Now, a lot of people wonder, gosh, I hear all this bad negative press about Part C Advantage plans. What's the story on these? Now, whether or not this is going to work for you depends on your needs and your situation. But what Part C Medicare Advantage plans have in common all over the country is they are always offered by a private insurance company, and they are funded directly by Medicare and your premiums, if any. Each private insurance company has a contract directly with Medicare for each person who enrolls, and Medicare agrees to pay that insurance company money for you to be a part of the program. You, in turn, agree to get all of your care through the private insurance company. So if you go on a Medicare Advantage plan, you're not using your red, white, and blue Medicare card any longer while you're on the plan. You don't lose Medicare, but you don't use it either. And you have to follow the plan's rules and use the plan's providers. The plans are regionally based. So what's available in Kentucky is not the same as what's in California or the same as what's in New York City. So where you are, even at the county level, you could be going from San Francisco to San Mateo County, and the options that are available are going to be different on a by-county basis. Most of the plans, not all, are going to include your AB, Original Medicare, and your drug plan benefits into one program. And they also offer a lot of extra benefits, things like dental, vision, and hearing that can be embedded in the plan, all under one program. Typically, Advantage plans are going to not have a deductible, but more so have copays or co-insurances, and they always have a max out-of-pocket ceiling of what you would pay. Now, a hallmark to an Advantage plan is that it has a network. So if the Advantage plan is an HMO variety, you're going to be required to have a primary care doctor or main doctor, and that doctor is going to refer you to specialists within the network. How the rules work can vary by state. In California, for instance, just because the provider is in the carrier's plan, they also have to participate through a network. So a larger picture where the specialists and primary care doctors are aligned for your care. So you must choose a primary care doctor and get referrals to specialists on an HMO plan. Sometimes there are Advantage PPO plans. Your Medicare is still assigned over to the private insurance company, but in order to get in-network pricing, you must use doctors that are within the plan or use providers of care that are in the plan. If you go out of network, you're going to typically share in more of the cost, and it goes towards a higher max out-of-pocket ceiling. The nice thing about Medicare Advantage plans, Part C, is often they have a low and sometimes no monthly premium. So essentially, you continue to pay your Medicare Part B premiums because that's part of how the plans are funded, but sometimes you don't have to pay anything extra to get a lot of perks added to your program, things like prescription, vision, dental, hearing, and lower cost shares for things like surgery or seeing your doctor. So the lower no premium is an appealing aspect to these plans. They're able to use Medicare's dollars more efficiently and pass those savings on to you. Sometimes the plans do have a small premium, but it's typically a lot lower than what you would pay under a Medigap and a standalone D combination of plans. The other great thing about Medicare Advantage plans is they're going to include often the medication coverage as part of the plan. So instead of you having to purchase separately a standalone prescription drug plan, the Part D is actually embedded in the Part C Medicare Advantage plan. So you get all of this under one umbrella. Use one card for doctor, hospital, pharmacy, and so forth. It can be very easy to use and convenient. And often the medication benefits included in Part C Medicare Advantage tend to enhance Medicare standard design a bit more than some of the low-cost drug plans. So this can be something that can be considered a nice perk on a Medicare Advantage plan. There are share of costs on Advantage plans. They can range from a 0 copay to 20% coinsurance or more, depending on the service. So that's something to keep in mind. But they always have a max out-of-pocket ceiling. Some of them can be quite low. Some of them can be much more expensive, particularly on the Advantage PPOs, and they're going to vary based on where you live. So if you're looking at Advantage plans, you want to look at those copays and max out-of-pocket ceiling and see if it works with your needs and budget, and to see if it's going to work for you. The other thing to keep in mind about Medicare Advantage plans is they are going to include some of the preventive care that Medicare doesn't. So for instance, the once-a-year routine physical is typically covered by the Advantage plans. Many of them have foreign travel coverage added to the plan to sweeten the pot so that you'll be interested in their program. So this is something to consider if you're looking at Advantage. Now, the most common Advantage open enrollment period is October 15th to December 7th. This is what's called the AEP, or the annual election period. Absolutely everybody who has A and B Medicare at this time of year and lives in the plan service area that they're interested in can enroll in a Medicare Advantage Part C plan with no questions asked. So if you missed annual election period this year, you have an opportunity next year. There also can be special enrollment periods throughout the year, depending on your needs and circumstances. So it's good to reach out to your agent or broker, or reach out to me in my office, and we can help you and guide you to learn whether or not you're eligible for a special enrollment period or an SEP. Is Medicare Advantage Part C right for you? So if you're already on an Advantage plan, you know that you've chosen it and you like the plan. If you want to consider an Advantage plan, what would mean this plan is right for you? Well, the first thing you'd want to do is evaluate all the doctors you see, all the providers of care, from your primary care physician to a specialist, to a mental health provider, to the local lab or physical therapy office, because Advantage plans are going to have contracted benefits with specific providers of care. And if those providers of care are important to you, you're going to want to make sure that they're available in the Advantage plan that you are considering. The second piece to this is checking on the prescriptions you take, the names, the dosage, the quantity, even the frequency in the preferred drugstore can make a difference to see which option is going to work with you. If you're okay getting referrals on an HMO or staying within a certain network and your providers of care are in that network and you like the copays and benefits associated with the plan, this can be a wonderful option for many people. And I see a lot of people accessing these plans with great success and satisfaction. Now, for some of you, you say, well, I don't like the idea of my Medicare being assigned over. I want to keep original Medicare as my primary insurance and simply get a Medigap plan. And that option is available to people. So when this is what's important to you, you do red, white, and blue Medicare. A and B is your primary insurance, original Medicare. And instead of assigning your Medicare over like you do on an Advantage Part C, you use your original Medicare card to access your care, and you supplement those benefits with what's called a Medigap, otherwise known as a Medicare supplement, otherwise known as Plan G for great or Plan F like fantastic. That is Medigap. And many people have chosen that because what they value most is the flexibility to see any provider that takes Medicare, including that local lab or physical therapy office or specialist, without having to get a referral or being restricted essentially by a private insurance company. So if that's what's important to you, this may be the type of plan that makes sense. Is it the most affordable option? No. Part D prescription drug has to be purchased as a separate policy. Typically, things like dental, vision, and hearing are a la carte policies you have to buy separately. The premiums are much more expensive than Advantage plans. And if you don't have one already, depending on where you live, you might have to answer health questions to determine your eligibility to get on a program like this. On the upside, the flexibility is great. You can see any doctor that takes Medicare that's willing to see you. There's generally very low out-of-pocket costs when you go to use it. So the key of a Medicare, original Medicare with a Medigap and a Medicare or Medicare supplement is access to the full Medicare network. Okay, so that's really a big deal. So even if you rely on a doctor to give you referrals, it opens up their access of where they'll send you. If you're a person who says, gosh, I heard about this doctor and I really want to have access to that physician, original Medicare and a gap plan may be continuing to be what's right for you. It's expensive. So the premiums go up as you age in most circumstances, unless you can get a community rated plan, which depending on where you live, they may or may not be available. The premiums are going to be expensive. And if it is community rated, meaning that whether you're 99 or 65, you pay the same, premiums are typically going to be higher overall. So that's something to look at. They also can go up based on inflation regardless of how they're rated. The prescription drug benefit is separate. So in some states, you can get a plan as low as no dollars. Fantastic. But to get a plan with no deductible, you're looking in the neighborhood of over $150 a month for a plan like that on standalone drug coverage, in addition to whatever you're paying for your Medigap. So it can get pricey. There is minimal share of cost when you use it. If you choose a Medigap or Medicare Supplement Plan G, for instance, outside of the $283 Part B deductible, you're actually covered 100% for Medicare covered benefits. So it's hard to beat that level of coverage. If you have a Plan F because you got your Medicare prior to 2020, Plan F like fantastic, there's actually no deductible at all. Both plans are very flexible and give you very full coverage, but it is expensive to purchase these types of plans. In terms of enrollment periods, when you're new to Medicare, everybody has a 6-month window to choose a Medigap or Medicare supplement plan wherever you live with guaranteed acceptance. Some states have guaranteed acceptance year-round. Many states do not. In some areas, if you want to move, for instance, from a Medicare Advantage plan to a Medicare supplement like a Plan G or F, you may have to answer health questions, and depending on where you live, acceptance is not necessarily guaranteed. So you do need to be careful about that in terms of enrollment. If you have questions about enrollment periods for Medigap or Medicare supplement, otherwise known as, you can always contact your agent or broker or contact me personally, and I'd be glad to help walk you through that and help you figure out what you might be eligible for. Is MedSup and D right for you? Now, again, MedSup is otherwise known as Medicare Supplement or Medigap. It's often known as Plan G or Plan F, and you pair that with a standalone prescription drug plan called Part D. And typically what I find is if this combination is usually working for people who really either need, require, or just want the desire to self-refer to specialists that are not part of just a specific network. Or they don't have a strong Medicare Advantage offering in their area. So Medigap makes sense. Original Medicare is primary and Medigap is secondary. To get drug coverage, you do have to do a standalone plan and determine what standalone plan is right for you. You need to go through that same exercise, the names, the dosage, the quantity, the frequency, and preferred drugstore of the prescriptions you take to figure out if it's going to work for you. So it's ABC Medicare Advantage or AB Medigap and D, either or, depending on your needs and benefits that you're looking for on your healthcare coverage. Now, the next hot topic that we're going to delve into is a little bit about Part D standard design for 2026. Now, something to keep in mind is that you can't buy Part D directly from the government. You either get it as a standalone policy that you pair with original Medicare and a Medigap or Medicare supplement like a G or an F, or you get it through a Part C Medicare Advantage plan embedded as part of the benefits. So it's important to note that Part D is separate, and if you don't take it or you have gaps in Part D, you can be penalized later on if you do choose to add drug coverage in the future. So it's important to keep and maintain Part D ongoing. Every year, Medicare publishes a new standard design for the year. In 2025, the benefit for Part D actually significantly improved with an out-of-pocket ceiling for the first time, and we are seeing some tweaks and changes to the standard design for 2026. The first thing you should know about Part D, standard design, and standard design means that whether you're getting the plan through a standalone drug plan or through a Medicare Advantage plan, all the companies out there are following Medicare standard design. So they can improve upon the design, but they're not allowed to make it any worse. So one of the components of Medicare's standard design for 2026, it continues to include a Part D deductible. A deductible means when you get to the drugstore or you use your mail order program, you're going to pay this first chunk of money before your coverage kicks in. In 2025, there was a deductible. This year it was $590. For 2026, it's going up to $615 across all plans. Now, how the plan chooses to administer that, that's what can vary. So for instance, there's still a lot of Medicare Advantage plans across the country that choose to waive the $615 deductible altogether. So that's one of the ways that they entice you to choose a Medicare Advantage plan is they're waiving that $615. For others, for standalone drug plans, for instance, some of the lower cost options choose to waive it from what medications are called Tier 1 or Tier 2, but then they continue to apply it to brand name prescriptions, tiers 3, 4, 5, or 6 as applicable. So it depends. Whether or not you choose a plan with a deductible is really going to look at an overall picture of the prescriptions you take and the needs you have for the given year. And we do our best to take that formula and match you up with the plan that's going to best suit your needs. The deductible is calendar year. So for 2026, that $615 deductible begins on January 1st and ends December 31st. Some of you will need to meet the deductible on your programs. Some will not, depending on your needs, situation, and plan coverage. Phase 2 of Medicare standard design is what they call the initial coverage phase. And this is a good way to think about the copay and coinsurance phase. So whether you meet the deductible of $615 on your own, or it's met by your plan based on your benefits, then you go into phase 2 of Medicare standard design of copays and coinsurances. Now, the prescriptions that are covered from one Part D standalone drug plan to one Medicare Advantage Part C plan can vary by company. So every single carrier is required to have at least 2 medications in every therapeutic class. It's kind of hard to get a bad Part D drug plan because they're being standardized in a sense by Medicare, but the actual brand names of prescriptions that they cover can be varied between the carriers. So that's a very important component when you look at plans for the next year. The other thing is that they can cover them on different tiers. There could be a big difference in your pocketbook if a medication that you need is covered as a tier 2 preferred or non-preferred generic versus a tier 3 preferred brand name. So that can also vary by carrier, which tier they put them on. Also, the copay or coinsurance that are charged amongst the tiers can be different amongst the carriers. So there's really no replacement every year from comparing the prescriptions you take to the available plans and seeing what's best suited for your needs or anticipated needs for the next year. What I can tell you is that if your medications are covered, they're part of your plan, or they've been prior authorized, because there's exceptions that can be made throughout the year, depending on the prescriptions you need, any deductibles, copays, and coinsurances that you pay for covered medications go towards a max out-of-pocket ceiling for 2026 of $2,100. If you reach that $2,100 max out-of-pocket, you're no longer going to pay copays, coinsurances, or deductibles for covered medications for the remainder of the year. That's up a little bit from 2025, where the max was $2,000. If you reach that phase 3 of Part D standard design, you're reaching what's called the catastrophic phase for Part D, and that means you're going to pay 0 copays, coinsurance, or deductibles for your covered prescriptions for the remainder of the calendar year. Again, that ends on December 31st, and each January it begins again. It's important to note that this is only for covered medications. If you need something throughout the year that's not covered by your plan, but you need it, it's possible for your provider to request an exception. And as long as it gets approved by your Part D carrier, it's going to go towards the max out-of-pocket ceiling. So that's really, really important. There are a lot of impacts to the Part D changes on your Part C and Part D plans. A couple things to note is Part C Advantage plans and Part D standalone drug plans receive star ratings from the government, from Medicare each year on the plans. The higher the star rating, the more revenue that plan has from Medicare to invest into additional benefits for you. The average star rating is 3 out of 5 stars. The highest rated drug plans across the country have 3.5 out of 5 stars for 2026. So the star ratings have been difficult for the plans to remain competitive. On Medicare Advantage Part C plans, there are still plans out there that have 5 out of 5 stars, 4 or 4.5 out of 5 stars. Those higher rated plans have more money to invest into additional benefits and also to offset some of the headwinds of improved Part D drug benefits. So star ratings definitely are playing a role on Part C and Part D plans going into 2026. One of the things that we're seeing across plans are premium changes. So particularly on the Part D drug plans, many of them have increased significantly in price. Most states still have a few low-cost options available, but many have plans that are over $100 per month for standalone drug plans. On Part C Medicare Advantage, depending on where you live, there are still plenty of plans out there at no premium at all, but we're also seeing Advantage plans starting to come in with some premiums to help offset some of the headwinds of lower star ratings and improved benefits on Part D over the last couple of years. Consolidation and exits. It was just a few years ago that we had over 30 standalone Part D drug plans. In most states, that's averaging about 12 plans available going into 2026. So again, the change in the ways the plans have been funded, the improvements to the benefits, and the impact of star ratings has created some consolidation, some plan exits. We see the same in the Medicare Advantage space. A lot of it comes down to the star ratings of those plans, because the lower star rated plans have trouble sustaining their level of benefits and coverage and remaining competitive depending upon where you live. We're also seeing changes to cost sharing and some benefit reductions. On Part D, we see it in the earlier stages. So it used to be that more plans would have copays, for instance, for tiers 3 or 4 or 5 medications. Now we're seeing more of a shift to co-insurance where you pay a higher percentage, causing people to reach the max out of pocket of $2,100 a little bit faster. We're also seeing benefit reductions primarily in Medicare Advantage plans. So increased copays, increased max out of pockets, increased cost share on certain services to help offset some of the headwinds of improved benefit design on prescription. And once again, on the impacts of some of the plans with lower star ratings, they don't have as much to invest into benefits for you. On Part C Medicare Advantage, a network matters, right? So remember, on Advantage plans, you have either a PPO network, where you have the flexibility to see providers across the plan's organization, or you choose an HMO, where you're choosing a primary care doctor and getting referrals to specialists. We're seeing some of the Medicare Advantage networks shrink or reduce. So some medical groups, some systems are not able to withstand the payment structure that they're getting from Medicare Advantage plans, and they're finding that they can no longer contract with some of the Medicare Advantage plans. Some of you may have seen an impact like that in your area for this year and had to make a change going into 2026. So there you have it. You've got your Medicare update for 2026. I hope you found this information helpful. Please add any questions, comment, interact with this on my YouTube channel. If you haven't subscribed already, it's so easy to do. Take out your phone and you can click on this QR code through your camera and just hit subscribe. Interact with the content. It's got everything on there, more than just this update. I'm here to help you every step of the way and just want to make sure you stay in touch with us. So please like and subscribe today. We would so appreciate that. Thanks, everybody.